Hey everybody, it's Dr. Yola. After some much needed rest, I'm here with another COVID-19 update. There are a lot of things that I want to talk about, but before I do that, I want to make sure that I express my heartfelt gratitude to each and every one of you who reached out via text, phone call, whatever method to let me know not only how much you appreciate me, but how much you appreciate every single first responder, healthcare professional, anyone working in the healthcare space, and our government officials as we're working collectively to address this pandemic. So I just want to make sure that I thank you so much. Now, let's get into some updates. I want us to talk about transmission because I'm getting a lot of questions about transmission, especially in the face of shelter in place and stay at home ordinances. I want us to talk a little bit about testing, talk about who's affected because I think it's important to revisit that issue. And then let's talk about treatment because that's one of the most exciting topics that have come up recently. And although I'm cautiously optimistic, I think it's important for us to really talk about treatment modalities and some of the information that's being pushed out in media, in social media, and mainstream media. So let's talk about transmission, particularly with these shelter in place and stay at home ordinances. People have become fearful that COVID-19 is now aerosolized. And based on information from WHO, now looking at Wuhan, China's data, now that China is coming over the peak of their of the infection in their country, we're able to look at transmission methodologies. And within the WHO's report, it has been demonstrated that the majority of patients who acquired COVID-19 infections were either through person-to-person transmission or through contact with contaminated surfaces. One of the main concerns in terms of aerosolized droplets was a study that came out of the US just a couple of weeks ago. There was a study that looked at how long COVID-19 lived in airspace. It was an experiment to determine the length of time that COVID-19 lived in the air. What it did not look at is the viral load within the air where COVID-19 existed, nor did it look at the infectivity of the virus in that airspace. It was just simply to look at how long the virus lived. It's important to understand the difference between looking at how long a virus lives in the air versus the risk of transmission. In terms of determining the risk of transmission, we have to know the amount of viral load in that airspace and the infectivity, how much of that virus is required within that airspace to cause infection. What we do know is that social distancing has been an effective methodology in terms of decreasing transmission. And if it wasn't an effective methodology, and instead aerosolization of COVID-19 is how the virus is transmitted, we would see countries like South Korea and Taiwan not having as effective a strategy as they did based on testing and social distancing. It's because of those two interventions that those two countries were able to really control the pandemic in terms of their populations. The other area of concern is the risk of transmission through fresh fruits and vegetables. Do we put ourselves at risk by eating fruits and vegetables in the grocery store? Now, theoretically, there is a risk if someone either sneezes or coughs all over the fruits and vegetables, ew, but it's possible, or if somebody sneezes or coughs, which is most likely in their hands, and then they touch the fruits and vegetables. There is a theoretical risk if you don't do two things. One, wash your hands after you've handled the fruits and vegetables, and two, wash your fruits and vegetables. That doesn't mean it's soap and water. Studies have shown that using cool to lukewarm water is just as effective as some of those products that are out there to clean off fresh produce. So if you continue to be concerned, certainly do frozen, but I will be honest with you. I'm getting fresh fruits and vegetables and washing them in the same way that I did before the COVID-19 pandemic, and I do not have concerns. I rinse it, I pray over it, and I eat it. So use your discretion and your comfort level, but just so that you know from a scientific standpoint, the risk of it is minimal, particularly if you do not implement those hygiene practices. There is a minimal risk, but when you rinse off your fruits and vegetables and wash your hands, you are protected. Let's talk about testing, which continues to be a challenge here in the United States. Despite what's being pushed out in media, we do not have enough testing kits or testing materials, such as the reagents that are needed in order for us to test our patients. For that reason, there are several states, and more states we're going to see become very, very strict in terms of who we as healthcare providers can test. Out of the Board of Physicians in my state, we just got a letter from the Secretary of Health letting us know that we can only test individuals who fit in the 4 categories that the CDC has outlined. Those include patients who have been in high risk areas. And in this country, we're not necessarily just including Wuhan, China, the 5 original countries, but even within our country in California and in New York, where we're seeing higher numbers of cases, those are also considered to be high risk areas. We're also considering individuals who have been in direct contact with a known positive COVID-19 patient. The other 2 categories of patients who will be receiving testing without there having to be sort of a debate or a fight are those individuals who are hospitalized, who demonstrate COVID-19 symptoms, or those who have been classically identified as high risk. Our seniors, those who are dealing with chronic illnesses, and those who are immunocompromised. We're seeing stories coming out in the media of people who are presenting with symptoms and being denied testing. And that's an actuality. I actually saw a nurse recently who's taking care of patients in ICU. Her patients were specifically COVID-19 patients, but she's in an ICU with COVID-19 patients. She developed symptoms and was denied testing because she did not fit directly in those 4 categories. And as frustrating as it is, I bring it up so that people have realistic expectations of what is going to happen when you present to a healthcare professional. There is a high likelihood that if you do not fit into one of those 4 categories, you will not get tested. And as frustrating and frightening as it is, I'm as frustrated as you are. But because we have a limited supply, we have to be very targeted in who we test so that we don't put those at most risk in a more vulnerable position, because that links to things like treatment. We know that for some of the treatments that have recently been identified, specifically Plaquenil and Zithromax, the timing of that treatment is essential. So it's important to know whether or not those patients are COVID-19 positive so that we know whether or not to implement treatment in order to decrease the risk of morbidity, which means the complications from the infection, and mortality, which means the likelihood of death. So as frustrating as it is, that's where we are now. The good news is that now over 180,000 people have been tested in the United States. The challenge is that when you compare that to a country like South Korea, which has 1/6 the population of our country, they were testing people, 20,000 people per day, practicing social distancing and testing people at 20,000 cases or 20,000 individuals per day. So it allowed people to identify whether or not they had the virus in order to decrease the likelihood of transmission. But for whatever reason, and I don't want to get into any political discussions, but we are limited in our capacity to test, which means that we're not going to be able to test everyone who's demonstrating symptoms. Instead, it's going to be self-isolation, doing those 6 measures to make sure that not only are you protecting yourself from infection, but if you suspect that you have COVID-19, and we've talked about this in a previous video, there are certain steps that you should take. So please refer back to my, if you think you have COVID-19 infection, what steps should you take? Because at this point, if you do not fit in those 4 categories, you're going to have to self-isolate and practice those measures. The other good news out of testing is that our denominator, the number of total people who have COVID-19, has increased. And as you'll remember in the first update that I provided to give a real good explanation of things like death rate, in order for us to have a clear understanding of an appropriate death rate, the denominator, the number of people who have COVID-19, is critically important in order for us to have a realistic understanding of the number of people or the percentage of people who die. Based on improvements in testing here in the United States and across the globe, we now see that COVID-19 has a death rate of 1.2%. So initially we estimated the death rate to be 3.4%. Now we're seeing it at 1.2%. And as prayerfully we are able to improve our testing methodologies and increase the number of tests that we can do with innovations like home-based testing or point of care testing, where you can come to any doctor's office and get tested. That's not happening yet, but it's to come soon. As we get more people testing positive and having a clear sense of the total number of people infected, that death rate will continue to decrease. And as much as we see in the media the reports of people dying, otherwise healthy individuals dying, it's important to have a clear understanding that the death rate has come down simply based on the number of positive COVID-19 cases that we have been able to identify.